morning, good afternoon, good evening. My name is Emmanuel Adegbola, and I would like to welcome
Can
everyone.
you help us connect our Nigerian
I'm so excited that you guys made it here today. And right with me in the studio, of course, I have the host of Keyna Health Show, and we have our main guest today, Dr. Fatire Egun, also with us. While we are still expecting our Nigerian guests to connect with us, we shall continue to pray. We hope they will land safe. So while we kick off the show today, let's bring in our guest to introduce himself, and he's going to be introducing also his practice and his locations. I was just discussing with Dr. Keyna which day. I never knew that Dr. Fatire Egun has almost about 10,000 locations within the United States. So he's going to be telling us about his locations, how you can locate him. So let me bring in Dr. Agbola Fatire Egun to introduce himself. Over to you, Doctor.
Good afternoon and good evening for those in Nigeria. Happy to be here. My name is Dr. Agbola Fatire Egun. I'm a pediatrician practicing in the Texas area. So I've been blessed to do what I do for about 20 years now. So I have a long track record. Started off way back in Philadelphia, born and raised, and then trained in New York. And that's where I did my residency training, my first job. Licensed in 3 states, United States, New York, Florida, now Texas, and in Texas area for about 14 years now. So my current practice is in Irving. It's called MacArthur Pediatrics. And so we have a melting pot of people. I've been fortunate to see Nigerians in my practice, along with, but in Irving, it's a melting pot. So I see people from East Africa, from Hispanic heritage, from Mexico, from Puerto Rico, all parts of the United States, and all parts of the world. I love doing what I do.
All right. Awesome. Thank you so much, Doctor. It's good to see you. And of course, let me bring in our co-host, Mr. Alex, to introduce himself to our viewers.
My name is Alex Mwahiri. I'm a co-host and the facilitator of David Domenico program, both here in the United States and in Nigeria. You're welcome to the program.
Awesome. And I'm going to be bringing in the host to introduce himself and to introduce the topic we'll be discussing today, Dr. Keyna.
Okay, hello everyone, and welcome back to our show. I am Keyna Health Show. I'm a family nurse practitioner. I practice in Mesquite, Texas. A few weeks ago, we discussed the sickle cell disease and the challenges people go through with the disease. As stressful and frustrating challenges sickle cell bring, just also the social challenges and consequences. So today, as we go back to reintroduce what we did a few weeks ago, we're also going to hone in a little more into how men and women and their marriage aspirations are shattered because of sickle cell disease. Many families are in constant agony and misery, in dealing with the disease and trying to find the right partner to move on with their lives. So I welcome you to today's show, and I welcome our panelists.
Awesome. I don't know if that is a Dr. or Miss Ifeoma Ifejika. Is she the one?
Yes.
Is that you?
And I'm not a doctor.
Okay, go ahead and introduce yourself to our viewers.
I'm Miss Ifeoma Ifejika, and I am the founder of the Sickle Cell NGO in Nigeria, Sickle Cell Interactive and Management Association, and I'm an interior designer by profession, and I'm 55 years old and I live with the disorder. So that's what prompted me to establish the NGO way back in 2005.
Wow. So you can tell more about this than just somebody that read it in the book or watch it in a video.
Yeah,
Oh,
not
God.
just my experiences, but over the years from the people I've been counseling and people we've been meeting and during our awareness campaigns. Yeah, we have quite a lot of stories to tell.
Awesome.
And
Awesome. Thank
I
you
want
so much.
to also apologize. Dr. Obi will join us soon. He had an emergency in his clinic, but he's about rounding up. He will join us soon. The medical
Awesome.
director for Schema, yes.
Awesome. Awesome. Thank you so much. I look forward to learn from you and to learn from Dr. Fatrigu. So over to you, Dr. Keyna
Thank
and
you too.
Mr. Alex. I'm going to be learning. Let me take my pen.
Okay, I think let's kick off the program by doing a little recap of what. Let's take 2 minutes to recap what sickle cell is to get everybody abreast of where we are. Dr. Fatigo, I think you might have to do that for us. Give us a 2 minutes recap of what it is, and let's move on from there. What causes it, and let us have a best eye view of what the disease is all about. Thank you.
Okay, sure. So sickle cell disease is an inherited blood disorder that affects countless people from different parts of the world. So usually it dates back thousands of years to how human beings dealt with malaria. About 1,000 years ago, go back to your high school biology, there's something called evolution and natural selection. Basically, humans had living in Mediterranean and sub-Saharan Africa and parts of the Caribbean, in India. Those who developed had malaria, they had an advantage over malaria if you had the sickle cell trait. And through the process of evolution, those human beings survived more when they had the trait. So what sickle cell disease does is, instead of having nice, smooth, oval-looking blood cells, it causes your blood cells to be misshapen into like a half moon, crescent moon type figure called sickles. These sickles, compared to regular cells, they don't survive very long. I believe regular blood cells can last, normal people, about 120 days. Sickle cells last about 10 to 20 days. And more importantly, because they're misshapen, they can get stuck in certain blood vessels and it can cause decreased blood flow. Cells don't carry oxygen as well as regular blood cells. So there's a distinction whether you have the trait, meaning like your body has information about sickle cell, but they don't have the physical attributes, meaning they don't have the sickle cell, or you have full-blown disease, which our guest panelist has lived with, in which case can cause different problems throughout the body. So from pneumonia to getting sick more frequently due to certain bacterias, to painful disease, to just needing blood to go along your daily life, requiring transfusion. So it's a rough life to have for someone who has full-blown disease, not just medically, in terms of the different infections you can take, the different hospitalizations you need, blood transfusions you may need, ulcers you can get in your legs, the swelling in your extremities, but also the cultural stigma, especially I would say, unfortunately, in our home, in Nigeria, where child is people say, "Oh, is this child cursed? Witchcraft?" So playing forward someone with sickle cell disease or even sickle cell trait might suffer from marriage shunning. That family as well. So there's many facets to this problem, but it affects just from sub-Saharan Africa alone, 200,000 to 300,000 individuals. And it's even hard for them, those living in Nigeria at least, let alone, I think I heard each of our guest panelists. So, miracle in those.
Okay. Ifeoma, let's come to you right away. We have established the medical angle of this disease. During the last time this program was on, we were able to talk about how the consequences the disease has on our people. But today we want to focus on the social impact. You've been on this. You say you are affected. You lived in it. So let us go to the social angle. How has this been affecting family relationship, marriages, and people living with it? So what has been your experience in that area? What has been the experience in the area of marriage and social relationship and young people trying to marry? What has been the impact of this on their lives?
I don't think she's there. Miss Ifeoma, are you there?
I'm here.
I don't think.
Okay. Okay, go ahead.
Yes, I'm here. I can hear you.
Okay.
Did you get my question?
Pardon?
Did you get my question?
Yes, I did.
Okay.
Concerning marriage, it's been it's like a double-edged sword. Some marriages break up, after when they have one or two warriors in their midst, as children. Like there's a situation I handled. The man just got up and walked out of the marriage that he wants a healthy child, and walked out on the mother and the daughter. And you see some other marriages because of wrong genotype screening results. Some people, they'll tell the man, oh, you're AA, and they go ahead and marry. Now they have a child with the SS genotype. Like one case I handled, the woman actually came to me crying that the child that was 9 years old, the boy, anytime he has crisis, he tries to hide it from her husband, because if she makes it known to the husband, he will accuse her of being unfaithful, that she went out to sleep with another man to have a baby, because his own result was AA. She had to take the intervention of their family doctor after a few months, almost a year, for the doctor to invite the man to do another genotype screening before she could, open up and all that. And they found that the man was AS, not AA. And you also have intending couples that when you tell them, hey, if you're AS and AS, it's advisable not to get married and all that. And because of, I'll use this strong word for lack of a better term, ignorance. They'll say, oh, the God will give us the Peking, will take care of the Peking. That's so nonchalant and so annoying to me. And I say it's ignorance because they've heard about disorder. They know that they are genetically, they're not, their genotypes are not compatible, but they don't really know what sickle cell disorder is about. So such intending couples, I just advise them, I say, please go to the nearest hospital. Ask them for a child that is going through sickle cell crisis. Observe it and see if this is the type of life you'd like to put your child through. If I tell you, you might think I'm exaggerating, but just go and observe a child that is having crisis in hospital. Then come back and tell me if it is okay for you to take that chance, or suffer the heartbreak and go find different partners that you can procreate with. But it's been an uphill task. I must say, a lot of people call me, oh, Ifeoma, please, this my friend is insisting on marrying his girlfriend. She's AS and he's AS. Please talk to him. He doesn't understand. Just explain to him a little about your life, what you go through, what children go through. It's we have a lot of work to do over here. We have a lot of work to do over here. A lot of people just don't understand what it's all about. And sometimes when I talk, people are like, Ifeoma, you're sounding a bit too stern. I said, well, cut me some slack. I live the life. So expect me, you should expect to sound like this. It is not, I bleed every time I see a child going through those pains. And in retrospect, the pains I felt as a child is as intense as what I feel now. It doesn't get any easier. And I can never get used to it. I can never get to each pain sends me rolling on the floor and crying. It's been like that since I was 9 years old and I had my first crisis. I'm 55, for crying out loud. I still can't describe the intensity of the pain because it's like my mind blocks it out. So it's not an easy thing. I just advise them, don't do it. Don't.
Okay. I think Dr. Keyna has a follow-up question for you. Over to you, Dr. Keyna.
Yeah, Mr. Format, we appreciate what you've been going through for 55 years, and I know it's not easy to handle. And thank you for all the work you're doing back in Nigeria to create awareness about this disease. But over the years, there's been several, scientific what am I to say? There are several things that have popped up that can help with those who are AS and AS getting married. There are several options, for couples that they can utilize. Are those, options not viable options for those who are in love and they've been going out and they've been together and they've done everything and then they found out that they are AS. So are you suggesting that they shouldn't explore other options out there?
There's one option that I've heard about that as a doctor, let me throw a question to you first before I answer that. Over the years, I've heard doctors advise parents, when you have a child, the genotype screening should be done after 6 months of birth so that the fetal hemoglobin does not obstruct or sort of like help to give it a wrong reading, because the child still has a bit of the fetal hemoglobin in him or her. So to get a more conclusive result, you wait until after 6 months to test the child. I don't know if that is okay, but I've heard that. Now, having that, knowing this now, and the process of, when you take in, when the child is like 2 months, they can check the child's genotype and decide whether to take out the baby or you continue with the pregnancy, depending on what the genotype of the fetus is. How sure can you be when even a child being born, an infant, you won't know until that child is 6 months old? Now you want to test the fetus and conclusively say, hey, this genotype reading is okay. Let's take it out. The child's genotype is SS. That's why I don't advise on that. Because you might end up doing something and maybe because of the fetal hemoglobin or something, the reading is wrong. And how many of such fetuses will you flush out? And how are you sure that you get pregnant again?
So
Those are the
Right.
reservations I have.
Okay, thank you. I'm going to have
talking
Dr.
about
Fati
this,
Regu.
Pardon?
I said thank you. I'm going to have Dr. Fati Regu weigh in on this specific topic, because here in the US, you know, there's a totally different way that the newborns are screened. And I believe it is a very sensitive test, you know, here in America.
So I think our Mrs. Ifioma kind of mixing two different topics. So we can screen here in the United States. Even my patients every day, I see newborns. They do. Every state in the United States has a newborn screening program, which they can test from the day the baby leaves the hospital, and we get results within even a couple of weeks of whether the child may have sickle cell trait or have actual sickle cell disease. There is some in my practice. We talk about if a patient is testing positive for sickle cell trait, then I basically tell my parents, hey, sickle cell trait is different than having sickle cell disease. Your child can do everything that any other child can do, with the exception of playing professional sports in a high altitude area like Denver, Colorado. In current events, we had a player who had to sit out in football. He had sickle cell trait. But I said, besides that, your child can do just about everything. In terms of if a patient tests positive for disease, then we immediately start penicillin on the child, and then we hook that child up with a specialist hematologist. The guest panelist is correct in the sense that those tests aren't foolproof, because there's an amount of maternal fetal hemoglobin that could go off the test. So in addition to my parents of children with trait, I tell them we're going to repeat the test between 9 months and 12 months, just so we can confirm. And there have been times where actually we thought the child had sickle cell trait, and actually when we repeat the labs at 12 months, that the child was actually wrong. That being said, I think we ended last program about sickle cell about seeing how we could get Nigeria in line with how modern medicine is practiced, in the sense that, again, we do this newborn screening, the day the baby leaves the hospital. The other thing that the guest panelist was mentioning was DNA testing. DNA testing is different than fetal hemoglobin. There's, whenever a child, whether it be for sickle cell or for cystic fibrosis or for other problems, Down syndrome, for instance, in the United States, there are ways to test the child. Since sickle cell is a genetic disease where you identify the child with disease at the DNA level, that's what that particular test does. That test is pretty specific, so we wouldn't be flushing quote fetuses down the drain as a misdiagnosis. Fortunately, though, that test also carries with it some risk. When you try to sample DNA, when a mom is in the first trimester, there is a slight risk to inadvertently aborting the fetus. So, to be honest, it's this type of testing is not normally done for sickle cell. A lot of times it's done for mothers who score positive for families want to know whether they have a child with Down syndrome or not before whether they want to keep the baby or not. So it's done fairly frequently in the United States and Western hospitals and facilities. Not sure about the acumen of how well it can be done in Nigeria, but DNA testing, fetal testing, different than testing hemoglobin at a young age. So just to correct that. I would counter the point two. I think we ended. I think that the medical director last program ended the show on a negative note in terms of saying any people with sickle cell traits should get married, and well, look what happens. To be honest, our guest panelist is 55 years old and has a disease. I don't think all those years were terrible. I'm sure there was an amount of joy that she experienced in 55 years. Life is life. I know my pastor says it's better to be a living lamb than a dead lion. So, I mean, vaccines have improved that can help prevent certain diseases that sickle cell patients are at risk for. Hydroxyurea, which is an excellent drug that just came about in the last 20 years in terms of it isn't very expensive either. I would think that can be distributed even in countries like Nigeria. Hydroxyurea helps prevent the number of sickle crises that will endure. Folic acid, even cheaper than hydroxyurea, that also helps sickle cell patients to make red blood cells, and that also helps prevent a lot of crises.
Yeah, sorry, doctor. We have a question. I want us to attend to the question before we continue. This is from one of the viewers on Facebook. He said, "What's their life expectancy? Because I'm surprised at Ifeoma's age. My name is Anne." So I guess this person is asking, because Miss Ifeoma says she's 55. So this person is asking what is their life expectancy. I think she's talking about the warrior. Who wants to take up the question? Miss Ifeoma, you want to answer that before Dr. Fatri Egun goes on it?
Well, I don't know what the medical profession has pegged the life expectancy at, but I grew up tormented with a lot of misinformations. At first, I was told I won't live beyond 18 years of age. When I passed 18, they said, "Oh, you'll die on your 21st birthday." And
where they are not God.
It's not funny. Really and truly. Imagine living your life
sort of fear.
With the fear of dying every day. And you cannot discuss it with anybody, not even your mom, because of the effect it will have on her. It affected my school. It's affected my work. Sometimes I wouldn't even want to read for exam. My mind would be like, I might not be alive when the results will come. What's the point? So warriors fight a lot of demons that they can't even share with them. Not even in my case, I come from a very loving family, and not discussing it with them is because I don't want them. I don't want to traumatize them or to scare them or to make them or start treating. There are just too many reasons why you won't be able to discuss it with anybody. The psychological effect of sickle cell is worse than the clinical manifestation, just as bad as it is. As bad as the physical, the pain that I've tried to describe is, psychological part of it is worse. So I don't know what medicine has pegged it at, but over here, somebody walked up to me. I guess I think I was 22 then. And she was like, "Oh, from I hear you have asthma." I said, "No, I don't have asthma. It's only me that will have everything. I have sickle cell, not asthma." "Ah, you have sickle cell. That means you soon die." To my face. Oh, yeah. Some people come to see you in hospital and they're like, "Oh, try and bear the pain now. Why are you crying like this?" Those things, as innocent or know how to put it. There are so many things we struggle with on daily basis. daily basis. And based on my experiences and what I have heard or witnessed or counseled people on over the years, pardon me if I say AS and AS, please, it's going to hurt. You're going to shed some tears, but please do not bring one extra child into this world if you can't help it with the SS genotype. If you can help it, you do all the bone marrow transplants, you take the hydroxyurea, yes, it works, it's perfect and everything. Do not bring a child with the SS. Let's try and reduce the rate of newborns with the SS genotype. That's my dream. Even if it's one person I convince, one couple that I convince, I feel very fulfilled.
Dr. Patrick wants to.
Yeah, before he, let me also.
We're still answering the question, Mr. Alex. They've not really
answered. I thought he needed what I wanted to say to give us a comprehensive answer.
Okay, go ahead.
Because we are talking of two environments, the Nigerian environment and the American environment. And so I want to believe that while he is answering the question, he should consider the deficiencies, the limitations of the Nigerian environment, and then and be able to recommend what most fits the Nigerian environment. So you can go ahead.
Okay, so yes, I would say what you were told way back even now isn't much changed. Without proper intervention, the life expectancy is about 18, 19 years old age. But with intervention, life and things have changed. Medicine has changed in 55 years. Little things like avoiding, it's tough to say avoid excessively in Nigeria, but increasing your fluids, drinking throughout the day, taking penicillin daily, taking your hydroxyurea, taking your folic acid. Again, those medicines aren't very expensive. There are clinics in Lekki and clinics in different parts of Lagos where immunizations should be prevalent. The Prevnar vaccine developed even as I became a physician, so it wasn't around 55 years ago. But the key bacterial organism that sickle cell patients are at risk for is strep, is pneumococcus. We have a vaccine that can, multiple vaccines actually, that can help prevent everyone, but even to certain high-risk people like patients. Vaccinations, hydration, ordinary vitamins like folic acid, common antibiotics. Penicillin isn't the most expensive. Penicillin has been around decades, literally. Whether it be through the usual channels or profit organizations, nonprofit organizations, you should be able to supply ordinary penicillin to our children in Nigeria who need it, who have sickle cell. So with that, the life expectancy, it may not be to the normal, which is in the United States, life expectancy is about 76. So a patient living in the United States with sickle cell still has other issues, even with prevention. But you can live a productive life, as is attested by one of our guest panelists, who was born in Nigeria. So by taking certain steps and linking in with a primary care physician and having certain common medicines that aren't very expensive, to be honest, and who knows what's going to happen down the road in the next 10, 20 years. There might be even more Medicaid to come down the pipe. I wouldn't say it's a death sentence to have these. There are things you can do to promote your life in addition that are tangible. Non-tangible things, of course, we have a pastor here on our panel, so of course prayer helps. Pragmatic things, there's plenty that you can do. Should couples be counseled? Absolutely. There's 250 million people in the world with sickle cell trait. So testing prior to marriage probably is something that should be done in Nigeria. There is a couple should be advised that people with sickle cell trait have about a 25% chance of producing an offspring with full-blown sickle cell disease. Sickle cell, these patients can live long enough that they can actually reproduce. So they can have children. They can even get pregnant. However, they should know that if you marry someone with sickle cell trait, if you have sickle cell disease, that percentage jumps up to 50% chance of having a child. So there's family planning at almost every reputable major hospital facility in the United States to talk to parents about about the odds of producing offspring. And then couples take the information right on their own. With that, on the horizon, there could be gene therapy where they can actually attack the gene at the level, probably not in Nigeria or with other countries of that ilk, but that's something that's not even approved in the United States. There's a lot of talking. It's a difficult decision, definitely. But to be honest, I think Ms. Ejika is a witness that it can be done. 55.
So let me kind of follow up with this question, because we're trying to, as you said, it's a very, very tough topic, and definitely we're going to have a different opinions when it comes to this topic, especially in the area of marriage. So I would like to ask you, Dr. Patrick. So let's say, okay, for instance, your niece or your nephew or your son or your daughter, okay, happens to be an AS, and this person brings another AS in and introduce to you that, oh, hey, daddy or uncle or brother, meet my fiance or fiance. This is the person I'm going to marry. And of course, let's say as a doctor now, you ask them, okay, maybe you know your nephew or you know your niece, that, okay, you are AS. And you now call him or you call her and ask, okay, have you guys, done the test? And he or she tells you, yes, John too is a AS, or Mary too is AS. So what will you do at that particular point? What will you tell him or what will you tell her?
Well, to be honest, that hypothetical really isn't that far out of the norm. I haven't shared this with you all before, but I have a form of sickle called sickle thalassemia. So it's not full-blown cell disease, but just like a parent can give sickle disease and a parent can give a thalassemia disease. Okay, so that's what I got. That's what my parents gave me. So I say that because all my children are going to inherit the trait. Have inherited the trait, to be honest. We've had it. So when they're old enough to, right now my oldest is only 13, but when they're old enough to make mature life choices like that, I would definitely propose whoever they're thinking seriously about also get tested if they sickle cell have sickle cell. Like I said, 250 million in the world have sickle cell trait, depending on, and it affects us West Africans more. So once you get the information, then you go from there. You talk about contraception, you talk about international adoption, if you're trying to procreate. Everything isn't about, well, obviously, if people go into a marriage expecting to have in a natural way, there's other cases, there's other disease issues, there's parents there's mothers with endometriosis, or parents who have lost, who don't have a uterus, and they have to, same vein, along the same vein, you do marry, you share that with your partner, and then you make decisions. Okay, let's adopt, or let's do something else, or let's do contraception. Hopefully we'll get to a stage when we'll have some kind of gene therapy where you can actually attack sickle cell at the genetic level. That's not approved in the United States as of yet. Something that you do that the same category of Down syndrome, whereas you go to a facility that can the DNA of your unborn child, and then you can get it after that. But there's options. And I know it's a difficult topic. Say that married, don't do this. But nothing in life is absolute. That's what in my 20 years in medicine taught me. There's no absolutes. There's never a never do this, or you should absolutely do this. Everyone's scenario, everyone's situation is going to be different.
Wow, thank you so much for sharing that. I think Dr. Keyna has a follow-up question or comment on that.
Well, yeah, well said. And I wanted to also bring a little angle of faith and religion to when it comes to marriage, for those that are AS and SS. And, in a Nigerian world, many Nigerian men, I think these days the church makes them, go to get a test before they can even get married in some of the churches in Nigeria. But back in the day, I was one of those that got married without doing a test. And I know several other people that got married without, I knew what my genotype was, but my late husband did not want to do the test. And I've talked to so many other people who were in the same shoe. I know this particular couple, they got married, they never tested. And during the process, they found out that they are both AS, and they are both AS. The man is AS and the woman is AS. Amazingly, they had 4 children and none of them was SS. So how do y'all, I know it's a 25% chance. So if they ended their marriage at that time, they would have never been, those offspring. Informer, I don't know if you're there.
I heard you. I heard you. If they had ended their marriage, they would have had offsprings, but with other partners. So it's not like they wouldn't have had children. They would have gotten other partners and had children. Okay. And I'm talking, so you guys might have to pardon me. I'm talking from the angle of the person that is wearing the shoe, not from passion or profession, like medical profession. I wear the shoe. I've seen children die before me. Dr. Agbola says folic acid is affordable. This is affordable. We got a donation of what's it called? Hydroxyurea. And there was a child we diagnosed when we went for our awareness campaign because we do free genotype screening. The father had been suspected but never had enough money to go run the test. So when we did that screening and found out he was SS, we now took the father aside and counseled him on how best to manage the child. So when we got this free donation of hydroxyurea, I told Dr. B, remember that child that came from Ubima for awareness campaign? Please, I'd like him to get some hydroxyurea. Do you know we called the father and he said he didn't even have transport money to come to Port Harcourt, come and pick up the hydroxyurea for the child. They live in the village. Ubima is just after the airport in Port Harcourt. Is the next village after the airport, so it's not even far. On a good day, 40 minutes or less than you can get there. So such a parent, we still have to give them the folic acid, the vitamin C, the B complex. They can't afford 500 naira folic acid that's supposed to last them for 3 months. The small pack of 500 naira. They can't spare that cash. So it's not, it depends on the level, on the person's income. He couldn't, the Reverend Father that organized the awareness campaign had to send transport money for the child to come, run some tests, and we decided on the dosage and everything. Is that bad? Some children stay in the house with having crisis. The parents can't afford to take them to the hospital to get treatment. They can't even afford paracetamol to give the child. I get called up at 3 a.m. One lady called me. She was staying in Obibo. Mama, my back, my chest, my waist, my this. So I had to tell her to give the phone to her sister. It was only her sister around. So please take her to the hospital. 3 a.m. I couldn't go to their place. I couldn't leave my house. And let me speak to the doctor. Tell him first thing in the morning, I will send some money to them. I'll be able to transfer. When you get there, send me the hospital account details so I can do some transfer in the morning. But let them start treatment. She was having the pains all over. Is the chest one that actually scared me because she was having difficulty breathing. So I couldn't say, oh, use the hot water bottle, apply this, keep her warm, this, that, just manage until morning. No. I said, please take her since she's having difficulty breathing. She had been having those pains for 5 days, no money to go to the hospital, and she was treating herself. There's one nurse nearby, she'll come and put drip for me. Drip of what? Set up a line, and then the painkillers, hoping it will go until it got to that stage. These are just very little, very few. There are more pathetic cases. And you look at this, yes, some churches insist, but Dr. Keyna, can you believe that some people go do the test, find out that they're not compatible, and pay the lab to falsify the result? So they'll be allowed to get married. Oh, I've seen such cases. Like I said, our NGO has been on since 2005, and we've been quite active, both in Nigeria and Uganda. We've been quite active. I have lots of tales and scenarios to show or to say. But the best advice, of course, I don't follow up and I don't insist. I can't call the police on them and all that, but I'd like them to have it at the back of their head that one informer told them, don't do it. A lot of marriages have failed. The love goes, sir, see what this child is going through. If not for your stubbornness, this child will be going through this pain. They start doing the blame game. Yeah, when I did this, when I did that, it happens. The love goes.
Thank you so much, Mrs. Firma. Because of our time, I personally, I can feel your heart, and I think I get it. Even if we give you 10 hours, I bet with you it's not enough. It's not enough for you to express what you have to express. And I'm a pastor. I will be praying for you and with you. And there is nothing God cannot do. I still so much believe in that. I know this topic, as I told Dr. Keyna one time when we were discussing this, I say it's a debatable topic in the sense that when you come from the angle of faith, and you come from the angle of medical, then you come from the angle of in-person, like this is not faith. I read it in Bible. This is not, I read it in book. Like in your own case now, this is what you have been going through. So we have three different angles of this. But the purpose of this show is, number one, to educate people out there, to create the awareness that, well, this is real. What can you do if you find yourself in this shoe? Then for those that also that are the warriors that are already in it, what can they do also to make sure that they prevent? I believe we can prevent, and that's part of what we are discussing. We can actually, be part of the campaign to eradicate this if possible. So we have these questions from our viewers, so that we'll be able to make this a two-way show. As we said, this kind of topic, you cannot get to the end of it, but we'll try what we can. Chairman says, have you heard of PGD, pre-implantation genetic diagnosis? Can you please talk about it? That's one of the questions. Then the second question is, what is the home remedy? I guess this person was asking Ms. Ifeoma about the pain. So how to combat the pain. So either of you can go first, and they just combine the two questions. Thank you.
So in terms of pain control, things at home that you can use, Tylenol and NSAIDs. So NSAIDs are ibuprofen, Motrin. Fortunately, when you get full-blown crisis, many times the ibuprofen isn't, and it's based on weight, the dosage, but for instance, like a 40-pound 4-year-old patient probably takes 200 milligrams. That's like 2 teaspoons of ibuprofen or Motrin. Fortunately, though, when you have full-blown crisis, ibuprofen may not be long enough. That's when we need our urgent care centers and our hospitals to kind of step in and give IV venous pain medicine like morphine, even when you're discharged home. That's why it's important to link up and have a medical home, whether it be via a nurse practitioner or a pediatrician or physicians. Need someone who can quarterback your care in terms of how you go about your daily life living with sickle cell disease. Need someone to kind of manage so that you're always, so that your young child with sickle cell doesn't get overwhelmed with suspected blood. With regard to PGD, from what I can understand, you can't really diagnose PGD because that deals with embryo. You would get the same information, really. So the embryo is just from the mother. It's not really from the father. Unless it's a fertilized egg, that's what you're talking about. So you're really talking about IVF, essentially. And those might be services that your in vitro fertilization company or physician can provide you in that regard. But at the bottom line, it tells a genetic disease. It's one little mutation that affects how your hemoglobin is formed. So a couple little changes in structure, and unfortunately you have sickle cell trait. And it's much better to have sickle cell trait, and it's much better to have the type of disease, milder form combination. So the sickle cell disease, you have sickle thalassemia. And there was no picnic growing with that either. But at the end of the day, my parents, thankfully, I don't know if they had that technology, but the other side of the coin is you're trying to avoid having the genetic material passed on. So you're fervor to do that. We're talking about, or there have been talks about aborting fetuses that have that. 50, I'm in my 50s as well, or just turned 50. I've had a productive life, even though I've had sickle cell. So in any case, the way to help prevent, an ounce of prevention is worth a pound of cure. Instead of waiting until you actually have a pain crisis, it's important to drink fluids throughout the day. The more you hydrate yourself, the better. Once taking vitamins, taking hydroxyurea, taking the folic acid. In the modern, again, we're not 65 anymore. Things again, up with your family physician or your pediatrician or your nurse practitioner, making sure your kids are vaccinated. Those are ways in which you can maximize your life, despite whatever medical ailment he or she may suffer. So there's always room. I would agree with panelists in that regard, the mental health aspects of having sickle cell rival the medical aspects of it. Depression runs rampant with kids with sickle cell disease, just because they're constantly sick. The constant public scrutiny. A lot of times, you or sickle cell patients tend to they think, oh, they're faking their pain. If the teacher doesn't exactly know what the child is going through, then the child is lazy. So definitely the mental health aspect is real. I would agree with that. I think there are ways where you can thread that in terms of helping people deal with this disease. A lot of the hurdles mentioned, hurdles that any one of us can alleviate by ourselves, is the structure of Nigeria in and of itself, corruption, but I mean, we tread on. And I'm the current local chair of our AMPA, Association of Nigerian Physicians, in the Americas chapter. Our motto is healthier Nigeria and a healthier world, and we try to do that one day at a time.
All right. Well, over to you, Dr. Keyna. As I said, it's a topic that we can never end. We have just 2 minutes for today's show, but I believe we still have a lot of questions.
Can I ask just one question?
Yeah, go ahead.
If you said normally you were not discussing your crisis, your challenges, even with your close family, with members of your close family, because of you didn't want to traumatize them, you didn't want because of the impact it will have on them. And we also discovered a lot of people while we were trying to do this program. We wanted to get some warriors, those who have survived from this, and they were not willing to come on board because they were hiding it. Do you think it's a very good approach to keep this experience to yourself, not to talk about it?
No. I didn't hide my crisis. I didn't hide the fact that I had sickle cell disorder. I said my fears I could not share with my family. While I was in secondary school, my mom handed me to the principal and said she has sickle cell. Please, this and this and this, take these precautions when she's like this. When I got into university, my roommates, I called all of them and I told them, oh no, I advise people to talk about it. Do not encourage the stigmatization by hiding it and making it look like there's something wrong. You've done something wrong or something to be ashamed of. What I meant was the torment we go through, for lack of a better word, the demons we fight in our heads sometimes is difficult to tell or share with people. Not the fact that I have sickle cell anemia. I even propagate it. Please let everybody know. If you're at work, if you're a banker, tell your colleagues. If you're a student, tell your roommates. If you're a pupil, please tell the school authority. Always talk about it. The stigmatization is real, quite all right. It is very real, but we have to learn to rise above it. Some parents even encourage their children not to tell people, but they're actually killing their children because when they're in pain, they will try and hide it. And the type of pain that you have during crisis is not something you keep to yourself. So that's double torture. That's double torture, yeah.
Wow.
Over to you.
Wow. Well, this was what we expected of this topic, and it's an emotional topic. It's a topic that many actually, the way we picked this topic, because a lot of people had questions and wanted us to talk about it. And I'm grateful to Dr. Fatih Regun, Ifoma, and Dr. B that have done some justice to this topic. While the struggle continues, and we will just hope to depend on science to bring the best, so that people can have some succor to their pain and suffering. I appreciate everybody coming on this show today. Back in Nigeria, there's still a lot of work to do. Like Dr. Fatih Regun mentioned earlier, we have Nurse Practitioners Association, Physicians Association, Pharmacists Association. Hopefully, some of these topics we can go back to Nigeria to have discussion with the government entities, non-governmental entities, so that we can see how to help our dear country. Thank you all for joining the show today.
And we really appreciate you. And just if you don't mind, we have a pastor in the house. So if you don't mind, we would like to just share a word of prayer with every family having the same situation going on worldwide. And peradventure, you're also connected with us, and you are going through this same disorder that we'll be talking about. Even though what the doctors are saying or what they have said is the fact, there's nothing that can change it. But our God also is a changing changer that can change situations. So if you don't mind, shall we just close our eyes as we have a short word of prayer? And I will call the priest in the house, Mr. Alex, to say a word of prayer to every family going through what we have just discussed.
In Jesus' name we pray.
Amen.
Lord, we ask you to come and visit all the families that have been affected by this sickness. Heal them, because we're told by the stripes of the wound of Jesus Christ we have all been healed. Yes. We claim our healing, and let this healing flow down from our head to our toes. Yes. In Jesus' name we pray.
Amen. Amen. Thank you so much, viewers, and do have a wonderful day.
Thank you.
Thank you so